The following segment is sponsored by Renown.
About 3,500 children are diagnosed with leukemia in the U.S. every year. Thankfully, Renown has a team of high-skilled and compassionate pediatric oncologists, specialists, all committed to helping children fight cancer. Here to talk more about the program is Dr. Martin Johnston, pediatric hematologist and oncologist. Dr. Johnston, thanks for joining us.
Thank you.
What exactly is childhood leukemia, and how does it differ from what adults have?
Well, leukemia, of course, is essentially cancer of the blood. It arises in the bone marrow where immature blood cells are growing and they undergo mutation and become malignant. The main difference between pediatric leukemia and adult leukemia is that in adults, much more frequently, they have what are called chronic leukemias, CLL and CML, that can come on very, very gradually and last for years. In children, most leukemias are acute. They come on much more quickly. The children have symptoms like fever, aches and pains, loss of appetite. It's a condition that if you don't diagnose it and treat it, you can die within weeks or months, versus a chronic leukemia, which can last for years.
And leukemia in children, it is one of the most common forms of cancer that children have to deal with. And those are the symptoms you watch out for. But some of those things that you're saying, you might just think that's just a regular virus or something.
Most of the time, by the time a child is diagnosed with leukemia, they've seen a doctor 2 or 3 times, and they've been diagnosed with a virus or mono or whatnot, and it takes a while to recognize that it's leukemia.
Okay. Your son was diagnosed with leukemia when he was just 3 years old. How was that personal experience for you? How does that affect the care that you give other parents who are literally going through the same thing that you have walked through yourself?
Well, the strange thing is that I was already a pediatric oncologist. My son David was 3 at the time, as you said, and was diagnosed with leukemia. He went through 3 years of treatment with a lot of ups and downs, and thankfully he's 29 years old and doing very well now. And I like to say it's the best credential I never wanted. When I talk to parents, I think it's very meaningful for them to know that I've been in the trenches, that I've experienced this. And I think as we talk about their child surviving, it helps them to have in their mind an image of an actual patient and not just a number.
And for you to be able to talk about your son who's in his 20s and who is healthy, that's got to be really encouraging for parents who are going through a very scary time.
It's true. And ladies, he's still available.
Okay, he's still available.
Yeah.
Good to know.
Okay.
Well, Dr. Johnston, thanks so much for your time. And if you'd like more information about this topic, you can go to renown.org/wellbeingwednesday.